Welcome to HealthWatch, presented by Novant Health. I'm June Baker, and I'll be your host today. We have a great show planned for you today. We're going to welcome Dr. John Rommel, and he's with Novant Health Heart and Vascular Institute. He's going to talk to us about heart failure and a new treatment that's available now here locally. And then we'll talk about colonoscopies and other GI topics with Erica Roberts from Novant Health Gastroenterology. And finally, Becky Whiteside from Novant Health Brunswick Medical Center, and she's going to talk to us about cardiac rehab and a new facility recently to open here on the campus at Novant Health Brunswick Medical Center. So stay tuned for more on HealthWatch. First, let's welcome Dr. John Rommel, a heart failure specialist with Novant Health Heart and Vascular Institute in Wilmington. Welcome to the show today, Dr. Rommel.
Thank you for having me.
So nice to have you here. So you specialize in heart failure, correct? Well, tell me what that means. What is heart failure?
Yeah, so heart failure is a term that, to be honest with you, sometimes is easier to see in someone, and it's one of those diseases that you know it when you see it, but at its core, what it means is, for one reason or another, the heart is not able to keep up with the demands of the body. And so the heart is not able to get blood to where it needs to go. And that can happen for a variety of different mechanisms.
I think I understand that. And is there a cure for heart failure?
Unfortunately not. Heart failure is a progressive disease. We can temporize it, we can stabilize it with medicines, with procedures, with devices, but ultimately it will continue to progress in most of our patients.
Wow, that's sad. Tell me about risk factors for heart failure.
Yeah, most of the risk factors for heart failure kind of fall in line with just general cardiovascular risk factors. So hypertension, diabetes, high cholesterol. Developing heart failure beyond that, history of coronary disease, obesity. As we get older, we can also sometimes see an increasing prevalence of heart failure. You know, we see it in our patient populations between the ages of 60 and 65. About 5% of our patient population will have it. Over the age of 70, it's as high as 10%.
Wow.
Yeah, but it can affect all age groups. But you know, again, as patients are living longer and doing more and getting their other diseases treated, we are starting to see an increasing prevalence of heart failure as a result.
Well, I read that. Excuse me. I read that heart failure is projected to be on the rise. Is that right?
Yeah, it actually.
How did you know that?
Yeah, the WHO actually called it an emerging epidemic back as far as 1997. It's something that we've seen just again because we are living longer, we are having other medical problems pop up, and as a result, sometimes these impacts affect the heart as well. And so we've seen it kind of across the country that the rates and prevalence of it just continue to kind of slowly trickle up everywhere.
Well, what are some of the treatments for heart failure?
Yeah, so the first thing we always approach is guideline-directed medical therapy, and usually nowadays we're talking about kind of four main pillars of treatment, which is beta blockers, which is medicines like you might see on TV like Entresto, spironolactone or aldosterone antagonists, and then a newer category that's kind of come to prevalence in the last few years called SGLT2 inhibitors. They're diabetic medicines that we've now demonstrated benefit, and if you don't have diabetes, just heart failure, you can still see the benefit of these medicines, and that's the commercials you might see on TV are Jardiance, Varziga, along those lines.
Yeah, there's so many advertisements on TV that I don't know who they're aiming them at, because I can't see myself walking into a physician's office and saying, I want to take Varziga. Well, I don't even know what that's for. But
it's true, but to be fair, some people do ask it appropriately, and it comes up more often than you think, and you know, I think it always leads to a good, positive conversation about what is and isn't appropriate medical therapy for our patients.
Yeah. Well, today I want to talk about one of the newest treatments that's on the horizon here, the mechanical heart pump.
Yeah, so this is...
I think it's got another name.
Yes, yes. So it's called an LVAD,
LVAD.
a left ventricular assist device, or specifically the one we'll be implanting in Wilmington is going to be called the HeartMate 3. And now this is reserved for people with advanced end-stage heart failure. So across the country, that's about 500,000 to 600,000 people a year. These are for people that have a weak squeeze of their heart for any number of reasons, and essentially medications and our standard therapies have started to fail them. So despite optimal therapy, despite optimal effort, we're seeing their heart just not able to keep up with the demands of their body. And for a group of patients in this category, for some people they qualify for this mechanical heart pump, which is a way to help them feel better and live longer.
So is it kind of like the last step?
Potentially, yeah. So when we cross this area, we consider this area advanced therapies. And when you talk about advanced therapies, the two major ones you talk about are heart transplant and left ventricular assist device. And obviously the problem with heart transplant is it's a limited resource, right? We've done a lot of remarkable things in the last decade, increasing the number of organs available for patients, but not everyone's going to be able to get a heart transplant. And a VAD can represent a very reasonable alternative solution for people who aren't candidates or don't want transplants, as a way, again, to feel better and live longer, which is our goal, right? Is to not just be...
Yeah, it's quality of life.
It's quality of life and life expectancy. It's together, you know. It's getting back to work. It's being able to go, you know, ride your motorcycle. It's going to play golf again.
Or fish or whatever. Sit and read a book.
Exactly.
Well, let's talk about that model, this multidisciplinary program that you have.
So actually celebrating our 10-year anniversary, back in 2013, we started what was called the Heart Strong group in Wilmington. Before we were part of the Novant family. And that is a group of nurse practitioners, nurses, pharmacists, myself, case managers that work towards trying to help our heart failure patients get on the right therapies. And that might mean meeting them wherever they are on their journey. Sometimes it's very early and it's getting them on guideline therapies. Sometimes it's late and it's talking about transplants and VADs. And sometimes it's talking about end-of-life discussions, the hard conversations that we know we all have to have. And the group's been fantastic. It's been a pleasure. I joined back in 2016, so the group was actually started by two of our APPs. And
wow, that's interesting.
It's been great. And it went from, I think, 2-3 patients a week to now we see about 1,000 patients annually.
Wow, that's truly multidisciplinary.
It really is, and it really takes all of us to make it work and move forward. It is amazing, and our whole team is just phenomenal.
That's great to hear. We can so use those services here locally in Brunswick, Columbus County, New Hanover County. That is one big area, and of course. NHRMC is our tertiary care facility of choice. We send all our patients there, and we're so thankful we have people like you there treating our patients. So I understand there was an accreditation that just happened.
Yeah, so
that's pretty exciting.
It was awesome. So most recently we got accredited just for DNV accreditation to start our VAD program, so the therapies we were talking about earlier. But about a year ago we actually got ACC heart failure accredited, and I think we were the third in the state to get that. Again, I think just kind of demonstrating our commitment to getting our heart failure patients on the right therapies and doing everything we can to try to treat them, keep them here in the community so they're not having to go hours and hours down the road to receive high quality care.
Right. That's hard on families. It's hard on the patient, but it's also hard on families when they have to go outside of this area for care. And really, in today's arena, that's not necessary anymore. We have pretty much everything they need right here.
That has been my goal since I joined here, was to get them what they needed here, and because it's not one single trip up there, never again. These are
it's
multiple times and sometimes weekly visits. And the more we can have our patients, as I like to say, sleeping in their own beds, the better off we're all going to be. So
everybody's better when they sleep in their own beds.
Yes, agreed.
Well, I can't thank you enough for being here today. I hope you'll come back because I can see so much on the horizon here that there's going to be lots to talk about. So will you come back?
It'd be my pleasure.
Great. Thank you so much.
Thank you.
Now let's welcome Erica Roberts, nurse practitioner with Novant Health Gastroenterology here at Brunswick. Welcome to the show today, Erica.
Thank you for having me. I'm excited to talk.
Great to have you. You do a really important job over there at GI, so I'm excited to get into this. This is a special month for us, right?
Absolutely.
Yeah.
Yes.
So tell me a little bit about your background and where you came from.
So I have been a nurse for almost 7 years. My whole career has been with Novant, which has been fantastic.
That's great.
Yeah, I grew up in St. Louis, but we lived in Charlotte, and I went to school at Rowan Cabarrus Community College to start. And then App State, and then I went to Maryville University to get my nurse practitioner. So it's been a fun ride.
Yeah. Did you always want to be a nurse practitioner?
I think initially I never, like when I was 17, 18, there was no way.
Of course.
But as I grew older, it really did start intriguing me. And the more I learned about healthcare, the more I wanted to advance my career and be able to help people.
Oh, that's a good story. How in the world did you focus on gastroenterology? Were you always interested in that?
No, to be honest, I didn't know where I was going to fall during school. The best part about starting in the emergency department is you have such a wide variety of things, and gastroenterology is a lot of those things.
Oh, yeah.
Abdominal pain and the gambit of things, and it has so many opportunities for me to learn. I actually really love it.
Oh. I'm sure you see a lot of the same conditions. What are some of the most
Prominent.
common? Yeah.
I would say for the most part, we see things anywhere from, acid reflux to,
Oh, yeah, I forgot about that one.
constipation, diarrhea. Then you go all the way to the other gambit, and you have people with some chronic liver diseases and inflammatory bowel disease. So it is a wide variety of things.
You have two gastroenterologists at the clinic, correct?
Yes, ma'am.
Dr.
Yes.
Futch and Dr. Andrews.
Yes.
Right?
Yes. They're both fantastic.
Yeah,
Great
they're
way to learn.
Great doctors. Let's talk a little bit about colonoscopy. Not my favorite topic, but
No, yeah.
I know that I think they've gotten the age is now younger when you start having colonoscopies. Is that correct?
Yeah. So now age 45, unless you have some sort of family history, but traditionally screening will be 45 years and older.
Is that because younger people are showing up with?
I think the preventative portion of it is the most important. It's not so much that we're seeing a dramatic shift of younger people, but if we can stop any progression, and that's a great thing about having a screening colon, because you're able to, if you have a polyp or something along those lines, we're able to intervene immediately.
So how often do you need a screening colonoscopy?
So if you have your initial colonoscopy and it is completely benign, there's nothing in there, every 10 years.
Every 10 years?
Yeah. Depending on what they find when they do colonoscopy, it can be more frequent. Family history, so first degree, mom, dad, sister, brother, or children, every 5 years.
Every 5 years?
Yeah.
And some people even have to have them more frequently. Is that correct? Like 3 years? Or?
Yes, you can do them as little as several months depending on what they find, but that's not very common.
What is the cutoff age? Isn't there a certain age where you don't need them anymore?
So traditionally, they're not recommended after the age of 76. However, people are living longer.
That's true.
Everybody's medical background or history is different. So, it's not an absolute. It's just a recommendation.
Okay. So like we said, March is colorectal Cancer Awareness Month. So let's talk about what we can do to reduce the risk of colon cancer.
Sure, absolutely. Some of the best things to do, avoid alcohol, avoid smoking, of course, get exercise.
How about eating? Do foods?
I think it's important to make sure that we are trying to eat healthy, whole grains. Fiber is a big thing when it comes to gastro health. Big time fiber.
Big time fiber.
Yes, fiber
is
where it's at.
Right?
No, yeah, exactly. We prefer fresh fruits and vegetables, but if you need it, it's definitely there. So 20 grams of fiber a day at least.
That's a lot.
It is, but it works so good. It makes such a difference in people's lives. I mean, I do it every day. We have conversations about that. So it really does make a difference. It's good.
Wow. What are some of the most common signs and symptoms? What should we be looking out for?
So I think it's really important if you have any type of rectal bleeding, any blood in your stool, dramatic changes in your bowel habits. Those are important. You know, colon cancer, it's kind of sneaky. There isn't like one thing that says, hey, this is it. So just being very careful and being aware and you know, minding yourself. And if you have any weakness, all of a sudden weakness or unintentional weight loss, those are things definitely to speak to your provider about and try to get kind of going on whether you need screening or if there's additional things that need to be done.
Do we need a referral?
I don't believe that many insurance companies are requiring referral, but I'm not 100%, and it really will have to be kind of dependent on what
The
your
kind of insurance you
yeah,
have.
absolutely, absolutely.
Okay. How about probiotics? Are those good for you?
So probiotics is kind of hard to say because there is not
Not a lot of data on that?
There's not, and there's not a lot of specific scientific data on one variety or one strain versus the other.
Yeah.
So it's very hard for me to make a recommendation. I usually say, you know, if it provides you with some good relief of symptoms, okay. I don't think that it's
Won't hurt
necessary.
you, but
I don't think it's
it
necessarily
helps you.
harmful.
As a side note, my dog is on probiotics.
Hey, I mean,
I'm serious.
Yeah, I don't think that's like.
She has pancreatitis a lot,
Oh,
so
bless her
they've
heart.
put her on these probiotics. So I thought, well, if
Is
they're
it
good for her,
working?
maybe that'd be good for me.
Yeah, I say get natural probiotics, so fermented foods, yogurts, things like that. So,
Yeah.
you know.
Well, so much good information,
Thank you. I
Erica. It's been
appreciate it.
such a pleasure having you here,
Thank
and I
you.
hope you'll come back at a later date and we
Absolutely.
can talk about something else GI related.
We could talk about liver. Let's talk about liver.
Okay.
It's
Sounds
less
good.
gross.
Sounds good to me. Thanks again for being here
All
today.
right. Thank you so much. I appreciate it.
Our last guest today is Becky Whiteside, and she is the Director of Operations here at Novant Health Brunswick Medical Center. Welcome to the show today. How are you?
Doing well. Thank you for having me.
I'm so happy to see you again. It's been a long time since you've been here.
It has
I
been.
know. So I want you to kind of reintroduce yourself to us. Tell us, I know you grew up here. You're a local child, so tell us about that.
Yep. So born and raised in Brunswick County. Left to go to college at East Carolina University, where I obtained my bachelor's in nursing, and then went on to do my master's in healthcare administration as well from Ohio University. Came here back to Brunswick about 14 years ago. Been with Novant Health that time, and done various roles. From quality, compliance, ER nursing, and then medical group, and shifting over to hospital operations.
How do you like operations?
Love it. It's fantastic.
That covers a huge, I mean, you really get down into the dirt and digging new foundations and whatever.
Yes, absolutely. Looking from how all ancillary departments support overall hospital operations, and then how that all basically comes together to
Yeah.
support the community and care we need.
That's an interesting job. Well, today we want to focus a little bit on cardiac rehab to start, and then we're going to talk about a new building that has popped up here on our campus. So first of all, tell me, what is cardiac rehab?
So cardiac rehab is really supporting the overall cardiac health. Heart health is very important, obviously. There's a lot of components that drive that, from high cholesterol, high blood pressure, weight, diabetes, all of those things that come into play on the overall heart health. And so cardiac rehab is a 3-month program, typically to help improve the overall health of your heart. And that is usually post maybe a heart attack or cardiac surgery, a heart surgery, or just a heart procedure. So it really looks at various aspects, whether it's through exercise, dietitian consults, just various programming to help basically encourage and impact the overall heart health of the patient.
I've even heard of folks going through some sort of a cardiac rehab prior to the surgery to get you ready for that surgery.
Yeah, absolutely.
So I know we have cardiac rehab here at the hospital currently, and I understand there's a new cardiac rehab space popping up. So tell me about that.
Yes, absolutely. So the current space is approximately 900 square feet. It's very small here at the hospital, so we are very excited to offer a large expanded space at the new Brunswick Medical Plaza, which is on the campus here at the hospital. The cardiac rehab space is actually going to be slightly over 4,400 square foot, so drastically expanded service. It's going to offer so much more to the patients that need the services. We will have a brand new walking track. We will have new equipment such as rowers, ellipticals, and then all brand new state-of-the-art equipment that we currently have. We will have new state-of-the-art equipment going into the space.
And you say there's a running track?
There is. Most of our patients do a lot of walking around that.
Oh, that's true. Yeah, just a lot of walking, which is such great exercise. And when it's cold out, that's the perfect place to do it. So where is this cardiac rehab? In what building? And tell me about the new one.
Yeah. So the Brunswick Medical Plaza is a 34,000 square foot building that we have directly beside our current medical office building that's on campus here at Brunswick Medical Center. In this space, there's going to be a variety of services offered. So walking in the front door to the left is cardiac rehab. It's going to be beautiful. And then directly above them would be our Novant Health Heart and Vascular Institute clinic, previously Cape Fear Heart. And then we'll offer additional services such as urology, surgical, primary care in this suite as well.
So a lot of the specialty care that's located in the current smaller unit next to the hospital, some of those will be moving over to the new building.
They will.
And what are you going to do with the old space?
We have to backfill it. So our OBGYN clinic will actually expand. Additionally, we're looking at other services that we can offer, additional specialists, additional specialty opportunities that need to be close on the campus here at the hospital, and to how we continue to bring in new services to the community and expand that.
Well, along those lines of adding specialties in this area, tell me a little bit about how we chose to put which specialists where, and where are all those places?
Yeah, so it's really important. Part of Novant Health's mission, vision, and value is meeting the patient where they are and providing the care close to home, and it being the right place and the right time for the patient. And so what we have done throughout the entire county, it's the largest county, square miles. And so as we look at that, strategically placing our specialists, so whether that's our GYN services or general surgeons or urology, we spread those out throughout the county. And so we use the central part or location in the county is Bolivia area, and that being really the hub for our services, where the hospital is in the middle point of the county. And then pushing those specialists out with additional coverage hours. So maybe less times during the week, but while running our central locations in the central part of the county. So we send to Carolina Shores, Calabash area, to Southport. We have offices in Charlotte, Leland, all of those areas to bring that care close to home.
So even while we have all these satellites around, we're still running the hub here in Bolivia. So their office here is open also, but also they may be in the various parts of Brunswick County. but they too move around, don't they? They may be one place Monday and someplace else on Wednesday. And
yes, so the providers all are centrally located, and then they move also throughout the county. So we do that very strategically. So if one patient wants to be seen in Bolivia, they can. By that same provider, they may be able to be seen in the Calabash area.
Yeah. And getting back to cardiac rehab, I know now cardiac rehab is located in the downstairs location of Brunswick Community Hospital, which is kind of a long distance to walk. That won't be the case in the new facility, is that right?
That's correct. So currently it's a little, accessibility to the space is a little more challenging for our patients, and really that is part of why we wanted to do all of this amazing work for our community. Putting it very close in this building, it will be on the ground floor. It'll be directly accessible through the main parking area right in front of the building. And so that'll be easy for patients. Obviously, great space, more services. We can expand further, and that is really our goal as we move into the next year after we open. We do have an expected open at the end of April and into May right now, with construction completing.
Is it in stages?
It is. So what we would like to do is add additional service and kind of phase those in as we open the new office. And so we could offer pulmonary services, cancer wellness, or even peripheral artery disease services. So really looking at the broad scope of services that we can now expand into our community.
So there's a lot coming on the horizon.
There are. We're excited.
The building is beautiful. It's already landscaped, and it looks great, and great parking. And I like the fact that the cardiologists are right upstairs and will be up there the whole time that the cardiac rehab is going on. And so how much safer can you get when you have a cardiologist right upstairs from you?
Yeah, direct accessibility for our patients, and if they need something.
Yeah, they're right there. And how are the doctors? What are they saying? Are they excited?
They are. Everyone's super excited. I mean, even if you look at this space, it's beautiful. Inside will be just as beautiful as the outside. So we're excited about all that it will offer to the community and just bring a fresh new look.
Good. I hope there's going to be an open house.
I'm sure there will be.
Well, that's great, because we're looking forward to that. And maybe we can have some footage of that and show it on our next show. So, Becky, what a great day to have you here. Thank you so much. You're always such a great guest, and you bring us such wonderful information about Novant Health. So I hope you'll come back soon, because with all those other things coming up, great opportunity to get you back on the show.
Absolutely.
All right. Thanks so much.
Thank you.
Thank you for tuning in to HealthWatch. I hope this information was beneficial for you and your family. To find a doctor or to learn more about services provided at Novant Health Brunswick Medical Center, please visit our website at novanthealth.org. That's our show for today, so be sure to join us next time right here on HealthWatch.
So I teach Health Science 1, and that is anatomy physiology. It is the foundational course for all of our health science courses. The students all have to take it. They learn all the body systems and just generally how the body is set up. And so one of the things that I have seen be very successful in other classrooms and other schools is the Anatomy in Clay program. And I really wanted to bring that here to West Brunswick because I thought it would really help our students engage with the different parts of the anatomy. This is a very expensive program. The mannequins that we use, they're quite pricey, and that was not something that the school system could support financially. And so to be able to bring that program here, we needed to look for outside funding. It's really important for us to receive support from people like Focus Broadband because it is really important for us to know that you support our kids, that you support our programs, that you want kids to stay in the local area and have jobs here and remain local to the community.